All right. Today we are going to be discussing acute diverticulitis. Let me see what it is, why it develops, how to recognize it, like symptoms, how we diagnose and treat it. Importantly, how to prevent future episodes as well. So let's start. Occurs when small pouches in the colon wall called diverticula becomes inflamed or infected. It looks like this, and you see small like a hole. It's like a hernia. This is what it looks like from inside the colon. This is the colonoscopy picture. You can see from outer side, it looks like this small diverticula here, and something happens like a stool stays there so long or something obstruct this opening that can cause bacteria to overgrow, even cause perforation and infection. That is called diverticula, is this pocket, and diverticulitis means inflammation in the diverticula. That's the diverticulitis. These pouches can cause localized inflammation and, if severe, lead to complications like abscess, perforation, even peritonitis, like generalized infection inside the belly cavity. This inflammation usually starts with a small tear called microperforation inside one of the pouches. It's often triggered by increased pressure in the colon or blockage of the pouch. Risk factors include a low fiber diet. High fiber diet is important for healthy bowel movement. That's a common sense. Obesity, lack of exercise, and there's some genetic component as well. Smoking is everywhere. Smoking is a common enemy. And frequent use of NSAIDs. They are ibuprofen, Motrin, Advil, these naproxen. These are the NSAIDs. Patients typically feel sharp pain in the lower left abdomen. Do you need me? Yeah, yeah, yeah. Allow me 1 second, please. Our staff have a question. Is it about a patient?
About the order.
Oh yeah. Okay.
The
Order.
Sharp 20 combination
Uh,
doesn't come in 25, only showing me 50 and 12.5.
oh, I think yeah, that's okay. Yeah, yeah. 50 milligram and 12 and a half sounds good. Yeah, that's okay.
Listening for 10.
Oh no, but let me just mute this. This is being broadcasted. Oh, sorry about that. So typically people complain of some sharp pain in the left lower belly because that's where the diverticulitis happens most common. And other symptoms include fever, chills, change in bowel habits like constipation or sometimes diarrhea too, and sometimes nausea or vomiting. Let's see. The best way to confirm acute diverticulitis is a CT scan of the abdomen and pelvis together, like a abdomen down to the pelvis, and we need a contrast for that. And we have to be careful because when someone has a diverticulitis, they are oftentimes already dehydrated, and dehydration leads to acute kidney injury. So above that, we are using the contrast. Contrast itself can cause contrast induced kidney damage. So we must monitor the kidney function very closely. If they can tolerate the oral hydration, they should be hydrated as well as possible, as much as possible. But when that's not possible, that's why we admit these patients as an inpatient so we can give the IV hydration. They need massive amount of hydration. Very important. So CT scan is the best way to diagnose it. I mean, I found it in the Google. I googled it for diverticulitis, and one thing is one misunderstanding about CT is people believe when we get the CT, we are going to be able to see everything so clearly. Oh, this is what, this is what. But as you can see, it's hard to tell which part of the image is colon or what, and in here as well. You can see in the left, like a lower side, almost like in the center, but you see like some hazy inflammation. I believe this is where the diverticulitis is, but I will leave it to the radiologist, and it shows inflammation and any complications like abscess, perforation. Blood tests can support the diagnosis as well. Ultrasound or MRI is not the best way to diagnose diverticulitis, but if CAT scan is not possible, contraindicated, then it could be not the best, but an alternative options. Blood tests may show high white blood cells or inflammation markers like CRP may go up, but they are not specific enough to diagnose somebody for diverticulitis. It can go up from any other inflammation. So we don't really diagnose somebody as diverticulitis based on blood test. We need a CAT scan to diagnose. For mild, uncomplicated cases, patients can often be managed at home with rest, a simple diet, and pain medicine. The key is we have to minimize like too much oral food, avoiding anything that goes to mouth, and resting the intestine is the key. The thing is, we need to avoid anything oral. Have a good night. Yeah. We need to avoid anything oral, but at the same time, we need hydration as much as possible. So, how are we going to do that? This is why oftentimes we admit people in the hospital because they can't tolerate anything by mouth, but they need hydration. So, we need IV hydration. So, they are admitted. NPO, nothing by mouth, and stay like that a couple of days and they get better. We gradually try like a clear liquid diet and soft diet and normal diet. Antibiotics are used selectively, mainly for those with more severe symptoms or decreased immunity. More severe cases, complicated cases like a perforation or peritonitis, of course, they should be hospitalized, and oral antibiotics may not be enough. So we use IV antibiotics to achieve higher level of antibiotics in your system. Sometimes even we do drainage of the abscess directly or surgery is needed. After recovery is also important. It's not that, oh, I feel better, now I can eat better, but pain is gone, fever is gone, I'm happy. No, we need some follow up. We have to do colonoscopy about 2 months, so 6 to 8 weeks after we fully recover, because unless they had it done recently, sometimes colon cancer could be the reason for this. We have to make sure there's no tumor or cancer related to this problem. This checks for other conditions like colon cancer. If symptom continues, like it got better, tolerable, but it's not completely gone, then also we do additional imagings or repeating the CAT scan. We can do that. But repeating colonoscopy, unless somebody had it done recently, is very important part of the entire care. We want to avoid repeat diverticulitis. It happens again. It can happen again. And whoever experienced diverticulitis never want it again. To reduce the chance of another attack, patients should eat a high fiber diet, number one. Plant-based diet is also good. And I said obesity is a risk factor for it. So healthy weight, losing weight is important. Stay physically active. I told you lack of exercise is another risk factor. And of course, avoid smoking. Smoking is everywhere. Regardless of diverticulitis, I always recommend to avoid smoking. It's also important to limit NSAIDs use except for prescribed aspirin. To wrap up, acute diverticulitis is common and has many contributing factors. Diagnosis relies on imaging, especially CT. Treatment is tailored to severity, and lifestyle changes are key to preventing future episodes. Thank you so much for watching.